Good morning. My name is Hamed Ekhtiyari. I'm one of the board members here in the International Society for Addiction Medicine. Welcome to this session. This is going to be our first keynote talk, and we are going to have Dr. Professor Jürgen Rehm here. And Professor Rehm is based in CAMH, or Canadian Institute for Addiction and Mental Health, senior scientist there, and also professor, and he was also the chair of addiction policy at Dalla, Lana School of Public Health, University of Toronto. I was looking into his publications, and it's just impressive the amount of work that Jürgen has done so far. His I-10 index is over 1,000. It means that he has over 1,000 papers that receive more than 10 citations. His H index is 171. It means that he has more than 170 papers that they have more than 170 citations. And he has received something like 230,000 citations so far. So the number of citations, the impact that he has done in the field of addiction policies is just remarkable. And please join me welcoming Professor Jürgen Rehm to the podium. And the floor is yours, sir.
Good morning. If you look at this speech, you may think that it's hybris to try that, but I have a good excuse. I was asked to do this presentation. It was not selected by me. Jens told me I have to do this presentation. So, it's not hybris. What I'm trying to do is I walk you through some of the principles which guide our regulatory approaches to substance use in a general term, meaning I will try to touch the fields of legal and illegal drugs, and I was originally trying to have over a few tables for most of the principles in all the different 5 or 6 different kinds of drugs, but that would have kept you until this afternoon. So I will allow 10-15 minutes of discussion at the end, I promise, and I'm trying now to be more selective and make most of the examples from illicit drugs and alcohol. So, okay. Okay. No, I think I'll do it like this. So basically the gimmick doesn't work, so we'll do it by hand. And it starts with, of course, substance use in history. It has a long history. There are a number of different kinds of classifications. There are a number of little tables like this one, but this is only for illustration. There had been evidence that substance use started before 10,000 before Christ and has been present. And the basic gist of it is, of course, that recreational drugs reward and reinforce consumption via pleasurable effects. That is something we always have to realize when people are saying, well, there is no positive effect of alcohol or something like that. Well, at least at some point there must have been something positive, otherwise people wouldn't drink. And the general population phenomenon of addiction is way more recent. And this has to do with modern ways to produce, conserve, and apply psychoactive substances, distillation played a huge role, bottling, and applying concentrated substances via syringes. So the population phenomenon is way more recent, and then, of course, during capitalism, global capitalism has created transnational corporations and countries with vested interests in promoting consumption of some of them. That is, in short, what made it now a population phenomenon. So, since substance use not only produces pleasurable effects, but also a lot of harmful effects, both health effects and social harm, there have been control mechanisms which also date back at least 7,000 BC. And 7,000 BC is only mentioned because by chance some archaeologists found some of those laws and regulations. We suspect it's actually been going on way longer. So one of the biggest controls was the restriction for ceremonial or religious use, meaning it could only be used by a certain caste in certain occasions, and the people were allowed to do it in certain festivities. That's it, once a year, twice a year. That's not a population phenomenon of using substance. The restriction to certain classes is clear. Then the social norms, prohibition, and then there are modern ways of restriction, which often, but not always, have to do with legalization. So basically, what are those modern controls? There is one which our dear Christine Lagarde has mentioned in one of her talks. There are two things which are absolutely certain. One is death and the other is taxes, and you can use the other to defer, you can use the one to defer the other. That's very clear, and that has been the case, especially for tobacco. The average tobacco tax share in Europe, for example, is 70%. That means for every euro you pay for tobacco, 70 cents go to the taxman. For alcohol, the similar number is less than 15%. So the taxation is mainly used in the tobacco area. The alcohol taxes are very small compared, and in no country does alcohol taxation pay for the externalities of alcohol. Meaning in no country the money brought in by taxation is covering the hospitals, the policing, etc., etc. So whenever people complain about high alcohol taxes, which happens quite often if you are part of the industry, that is BS. The high taxation does not cover what in every economic textbook in capitalism is seen as the dutiful mechanism to bring in money to pay for the costs of something. And the bringing in the money to pay for the costs of alcohol, in most countries we are under 1/3. Then the availability restrictions. You just cannot get alcohol all the time. And this is a classic thing. Same is, of course, true for tobacco. Availability is one of the standard procedures. You cannot smoke in the hotel. Our hotel said you're fined by 200 euros cleaning fee if they detect any smoke. So then ban on marketing is one of the classic ways for legal substances. This was, for example, when Canada had legalized cannabis use for leisure activities. Very clearly in most of the provinces, this is provincial law, in most of the provinces there was a clear prohibition of any kind of marketing. In Toronto, even though we have more than 500 shops, legal ones and illegal ones, they all, because the police is not doing anything against the illegal shops, but if they would do advertisement and would show their nice cannabis in the shopping window, then the police would come in, because that is seen as something which has to be policed. Then we have, of course, modern ways is the restriction of dose. Heroin was quite popular in Germany in the 1920s. Bayer did it, the Alpenverein, the local patriots of climbing the mountains in Bavaria. I'm coming from Bavaria, so that was not against Bavarians. Made a lot of ads for heroin. The ideal way, if you want to climb higher, the mountains, is, of course, take heroin from Bayer. Then we have here in the middle, we have some wild array of light beer, and then we have the light cigarettes, which had some problems, but at least it was some modern ways to restrict legal substances. And that basically means that most of the modern ways have to do with the active ingredients relevant for harm. The good taxation, I mean, there's just been an effort right now, it was in Mexico 2-3 weeks ago, to define what is the ideal taxation for alcohol. And the ideal taxation for alcohol is specific taxation with a pretty high base, and based on pure alcohol. Meaning if you have alcohol which has more alcoholic content, you have a higher tax than if you have less. And that was pretty clear, one of the few things which were easily agreeable. The rest of the 2 days were the less agreeable things on what is an ideal taxation. You should tax cannabis based on THC. That is something, unfortunately, that most Canadian provinces have not done, with one of the consequences that it is getting higher and higher in THC. That is something a lot of the trials in Europe do not respect. They say, oh, we have to have at least that much THC, because if we don't have it much THC, nobody will buy our stuff. Well, that is a little bit of a strange argument. First of all, if you want to legalize something, people will buy also because it's legal. There are always a lot of scared people who don't want to buy illegal stuff. Secondly, you could do it differently. But anyway, you should tax cannabis based on THC. It is very difficult with tobacco, because nicotine is one of the substances, but it's not the most lethal substance, so it's much harder to actually tax tobacco based on the most active ingredient. Illicit drugs you can do based on lethality. Lethality would be, but of course they're illicit and you can't tax them. And gambling taxes should be based on the average losses per minute. There had been a commission of the Lancet lately, just finished work last year, and gambling taxes is, of course, one very important means to reduce gambling. So, when I come to the overall is what are the values of our society and what is the nature of our response. The values could be individual or could be social responsibility first. If we do social responsibilities first, then we could still react and mitigate or anticipate and prepare. In illicit drug use, most societies react and mitigate. They react to the newest trends, are completely surprised that those newest trends come, and then they try to react. Usually, even solidarity, even social societies which have in mind social responsibility have this strange idea that the child has to be already fall down before you do something for it. You should not prevent it. Then, if you have individual responsibility first, basically, if you react and mitigate, it is like always. The rich will get better treatment, and the inequality due to drug use will have a widening gap. And if you anticipate and prepare, you will have market-driven societies, and they basically will take whoever wins the election or who is the most vocal. We have strange elections, strange results happening, and the most vocal may not be the best for the country or the best for the problem. Then we have, if solidarity prevails only, if we are trying to deal with all sorts of substance use in a large-scale, long-term action. And that is something we don't have a lot of good country examples. So, what are the aims of the regulation? Well, we should prevent heavy use. We should prevent mortality, prevent overall health harm, prevent social harm, prevent overall harm. We want revenue. You know, the taxes in Lithuania for alcohol have been raised. Why? Because of the war in Ukraine. It was a one-time measure to help Lithuania contribute to the war in the Ukraine. If they win the war, they promise to take back the taxation. I'm not saying this will happen, I'm just saying that's what they said. So basically, revenue, and they are well aware in the country that those taxes will also do good to their health care, they will have less hospitalizations, they will have less mortality. That's a given, but the main motive for taxation was to increase revenue and maximize well-being, and there are different of those. So, what would be the different potential aims? Well, there is a long exercise which David Nutt has started some 20 years ago of those different criteria. And all of those criteria could serve as a reason to limit substance use. And then you can combine them by some kind of mathematical transformation with some assumptions. I'm not going to go into those assumptions, it's not part of this topic, but basically societies, when they look into substance use, should look into some of those criteria, or we've had that, create your new criteria. This seemed to be the criteria we done in Canada earlier this year. So we had harm to the user, harm to others, and we had physical and mental, and then social, and also physical and mental to others, and then the whole social outcomes of substance use. If you add all of that together, for Canada, you see that, and that's not a surprise because that's relatively similar to other countries except the US, it was decided that overall about alcohol is the most harmful substance in Canada, followed by tobacco, by opioids, cocaine, etc. And that is based on these kind of criteria. So people, it's like when they select a new pope, you know, you put a bunch of 30 scientists together in a room, and until the white comes out, then you have the result. So, what are those criteria and what did they contribute to those drugs? Basically, you see here that it is quite interesting that overall you have quite a lot of mortality associated also with legal drugs. There are more people dying in Canada due to alcohol or tobacco than of all illicit drugs together. That is very clear. But there's a number of other criteria. I will not read them all to you, but the basic gist of it is that different values in a society, whatever people select as their number one, will be important in this analysis because this is driven by society and by the selection of who does it. In the illegal drugs, you basically have this situation. You have the opioids, and NP means non-pharmaceutical, because we also have a number of problems with opioids, pharmaceutical opioids. And there you have not the overall mortality, but the drug-specific mortality. The Canadians have quite a lot of overdose deaths, both for opioids or for methamphetamines or for mixtures out of that. And that is a completely different picture just from the psychedelic approach. You see this is way dominated by much different colors than this. And obviously all of those slides will be available so you can study in detail. So, if we say that overall we have way less problems, overall harm in Canada in illicit drugs compared to alcohol and tobacco, so we say prohibition has worked or works. Obviously, this is not the case in Canada, and at this point, to be very frank, in the last election, society has cared mainly about illicit drugs. It was not an election. The election in Canada, at the end of the day, had wonderful topics. But the number one reason why Canadians voted for their current number one was Donald Trump. And he was not in any of those lists. What is your main reason why you? Okay? So the main reason why supposedly Canadians voted was number 3 was drugs. In some of those surveys, number 2. Number 1 was housing. And clearly, if this commission said, okay, our main problems with substances is alcohol and tobacco, and the voters say our main problem is drugs, there is a problem. And we'll come to that later. Because that is one of the classic problems of modern regulations for substance use. We have way too long, and it's we, including most of the scientists, we have way too long overlooked to sell, to convince other people about our solutions and our view of the problem. And that is one of the problems why we failed. So, what are the attempts in Canada? Safer supply. Basically, whole cities decided that the main problem of drug use is that drug use is because of the toxic supply of drugs on the street, fentanyl and others. So if only we give them medical grade hydromorphone, everything will be good. And there are some studies saying, yes, it did work to a certain degree. Problem is, to a certain degree. What happened when a city is giving hydromorphone for free to drug users? Well, we do regular surveillance of drug testing. So there we ask for the price. Guess what? The price went from $12 to $1.50. About 1 week after they did this safer supply. And what happened? The usual. The proponents of safer, that was so good, they have a right to do that. And the others said, look, but this is now diverted, and organized crime doesn't like that if it's only $1.50. So they bought it all and shipped it to other parts of Canada without safer supply. I mean, Trump would have liked that. It was a classic, good entrepreneurial move, but it did not help the overall problem. And the overall problem is that, yes, it did something good for those who got the safer supply, but did it something good for society as a whole? And at this point, there are more articles written about why it's so good and why it's so bad than trying to make a real evaluation. What are the positives? What are the negatives? What are our values? Were we actually entitled to do so or not? Nobody does that. It's all like that. And then, we have also decriminalization of drugs for personal use. One of the provinces did that, British Columbia. Then they had an election. Shortly before the election, they were almost losing the election. I'll come to that later. And then they stopped it basically after 12 months or 14 months. And now, again, everybody has a clear opinion about that. My God, 12 months is nothing. You cannot even evaluate that, and you can't say wait longer because it was stopped. So we don't know if it was positive or negative. What was positive, of course, is way less people went to prison. That's already one positive sign. So if everything else is the same, that is already positive. Then we have a four-pillar concept, we have conservative backlashes, and overall we have a battle at heart between conservatives and liberals, which are the Canadian version of social democrats. Okay, I'll give you two examples. When cannabis was legalized, it was within the top 5 themes in surveys underlying the decision of voters. So people care, and the majority was clearly for legalization of cannabis. And there was no Trump. So the guy who promised legalization got some brownie points. Some people decided to vote for him and the liberals and for Trudeau because of that. The NDP was for decriminalization. The conservatives were basically for medical marijuana and opening the back door without having to ever say that they want to legalize, because it's against their values, but they still wanted to do it because they didn't want to lose voters. So that was not seen as very clever. So this is just some random thoughts about the day before election. How important is regulatory policies in a country like Canada? Second is BC decriminalization. I've already told They said for a long time, decriminalization will change everything. And so they were granted exemption on the 31st of January 2023. It was 2.5 grams of either heroin, morphine, fentanyl, cocaine, methamphetamine, MMDA. One of the problems with 2.5 grams means something completely different with those drugs. You can kill half a city with fentanyl no, I'm joking, don't quote me, okay? But it's way more potent if you have 2.5 grams of fentanyl, or pure fentanyl, and you're likely not a user if you have this pure fentanyl, than if you have 2.5 grams of ecstasy, very clearly. But police has only one scale, and they had to run around with those scales and weigh these things. So 2.5 grams it was. And then, as I said, they nearly lost an election because of drug policy. So the Conservative Party in that election went from 2% to 33.3% and won 44 seats. That's almost a majority. The NDP lost 10 seats compared to the last election and barely held on. The slogans were, "We are for common sense change. We are against drug decriminalization. We are against harm reduction policies. We will shut down all safe consumption sites. We will end decriminalization. We will end the safe supply experiment. We will enforce involuntary care. If we only treat everybody involuntarily, the drug problem will be gone in 1 year." I'm sorry, I cited that. So, problem was, again, we know those slogans. They've been around for 20 years. But what was the situation? We did surveys. One of my research projects is to evaluate the effects of decriminalization on society, including people who use drugs. So basically, when we did our first survey, we had just under half indicating that they personally felt less secure since decriminalization was started. This is a feeling. This is a sentiment. You cannot argue against the sentiment. Of course you can argue and say, look, this is what happened. These are the criminal numbers. People are not reached in their hearts by that. So, plus they often have different sources who do not give the exact numbers. I mean, we are in a different world these days, and that means this sentiment that decriminalization is violating the safety of their own was one of those reasons for the 44 seats from 0. And why? Why did liberal society, why did liberal media, why did scientists, why did the NGOs not do anything against that? Why didn't we argue? Why weren't we on the streets and said, look, this is there, what is it? It is because we do our discourse in conferences like here. And we don't reach a lot of people here. We reach a lot of others who will think relatively similar to us in the first place. So that is a very important thing. And the data were very less stunning and sensational than the political predictions. Basically, legalization was associated with increasing consumption, some increasing harm, but it's not clear to what degree that was causally impacted by legalization. neither the best case scenario of supporters, better public health, that was the credo which went to Parliament, nor the worst case scenarios, marked increase in COD treatment, marked increase in hospitalizations, deaths, materialized. Overall, it was some trends, some more consumption, harm in the traffic area for sure, but otherwise nothing big, no big changes. Decriminalization was interrupted, as I said, after 1 year, so no real evaluation can be done. But at that point, 9 out of 10, except the ones who were politically driven, evaluations were everything the same, except that less people got busted and had to go to prison. That's basically the gist of it. And for every publication which says, oh, we have shown that decriminalization is negative, I can get another analysis on the same data with a slightly different method and have exactly the opposite. I mean, let's face it. We have 12 months. We need time series. And some of those indicators are collected every 3 months. That means 3 time points. Have you ever done a time series with 3 time points? Don't worry, it doesn't work. And the most important problem, Canada, nothing. Nothing about on alcohol, not part of any election, except for now, in a different sense, the Ontario Premier said as part of his NTUS program, yeah, right now Canada is always NTUS, you have to do something. We have to really drink Canadian, yes, and we do that when we spend hundreds of millions to boost the alcohol sector, support for grape farmers, for wineries, for both for Ontario distilleries, craft breweries. It's going into the billions, and that was all part of the NTUS program. So what did we learn? We first need to identify main substance problems in a country. This could be done by a number of techniques. I've just given one example. And we have to invite the scientific community, people with lived experience, the general population, politics. And that is far too often not done. Look at those analyses. Which countries have included more than the scientists? Not a lot. We have to look into known effective policies to reduce problems. And in democratic countries, we have to convince the public. We too often, especially in the drug field, have a top-down approach and are within our cycles. And that is not in the general population. Then we have to monitor results and be willing to change when the results are negative. Safe supply was a good idea, didn't work. We could have stopped it after 2 weeks. Was not stopped. So, now we're switching gear. I'm not going to talk about Canada anymore. So, which country contributed the most to the current decline in the global level of alcohol consumption? Alcohol consumption is one of the major risk factors. Had been one of the top 10 since those league tables existed. That's a long time. And it has been constantly there. Alcohol is always one of the top risk factors. So, which country did that? The only country who meaningfully contributed to the decline was China. Well, why? Because China is so big. Very clearly, if you have so many billions, you have a higher chance of contributing to a global indicator than not. But basically, as you see from this blue line, after the year 2015, Chinese consumption per inhabitant went down 33%. Now, what was the reason? Which grandiose alcohol policies did that? Reason was the anti-corruption campaign of the Chinese Communist party. And basically, it was established for a completely different purpose. They were quite surprised when some of the main distilleries went bankrupt. Because, well, China is a country where has one of the most biggest sex differences between for alcohol consumption, and mainly males. And in China, alcohol was part of everyday life, was part of transactions, was part of functions, etc. And here you see some good reasons why it was. In the literature, by the way, you still have things like, oh yes, they had a very good drinking driving law. Yes, that contributes that much. A drinking driving law is not going to change the alcohol consumption in the country. So, is it plausible? Yes, it is plausible because we have so many people involved, and from this anti-corruption, they could no longer drink in public, they could not use alcohol for any of those dealings and wheelings. Nothing happened. So, we did some plausibility checks, that is the only plausible reason in terms of policy. And what was expected, what caused this consumption to climb? Well, basically, it climbed because of economic growth. There is a theory which clearly says that if you do economic development, alcohol consumption will increase, especially in the poorer countries, okay? And it's also life expectancy will increase. The question is, what does this increased alcohol consumption do to life expectancy? And this theory is based on a Nobel Prize winner, Angus Deaton, who has made the great escape with countries who are now high-income countries, but he talks about his grandfathers and great-grandfathers. And we checked that in the ASEAN countries. The ASEAN countries are 10 countries, which you have here, and basically these are the indicators. As you see, and I'll give you the scale for the GDP PPP differently for the high-income countries in order that you can see it better. But basically, they are the countries with the highest economic growth, okay? And what you see in life expectancy, it's also growing. So de facto, we did the causal analysis, yes, Deaton is right. But alcohol, in some countries, it's stagnating, in some countries, it's growing. So what is the difference? The difference is that there was almost linearly growth in almost all ASEAN countries, and that impacted life expectancy as predicted by Deaton, but it also impacted levels of alcohol consumption, but only for non-Muslim countries, and if the country didn't do a strong alcohol policy. So basically, your alcohol consumption will rise, but only if in non-Muslim countries. In Muslim countries did have all of this growth, but did not have the alcohol and did not have any problems, no matter if they banned alcohol like Brunei, or if they allowed alcohol like Malaysia. All of those countries have less than 1 liter per capita. So, we did policy scores to establish this, and that was based on the best buys. And basically, you have here the different countries, and you see in those countries which had no alcohol control policies, you basically see that all of them have very linear trends. And that has been established, and the correlation was 0.9, and then you don't need a statistician. So, is that only in low and middle income countries? No, the OECD has shown that in high income countries, OECD is this club of high income countries. Basically, that the GDP in OECD countries is 1.6% lower due to diseases caused by alcohol consumption. And they have a model where only the consumption above 1 or 1.5 drinks per day on average would do that. So basically, all of this, and I hear that in every alcohol conference, people say, but it may be good for the economy. There is no evidence. People have to show me. There is no evidence. Malaysia has the highest economic growth without any alcohol. Similar countries, that you do not have to have alcohol for any economical reason. So, what did we learn? There are unconventional approaches. There's, if you don't have a communist party and you don't have the execution of a law like the anti-corruption law, you have to do something else, a little bit less drastic. And that could be alcohol control policies, or you can change your religion. That didn't work for most countries. That was something they did in the 14th and 15th century, 15th and 16th and 17th century. It doesn't work. So alcohol control policy is the only thing. So what did we said we wanted to do that. Solidarity prevails. Now, last example. I told you I have 10 minutes for, so I make it very quick. Pandemic. What happens during pandemic? Basically, we have a lot of stress in most societies. We have lockdowns. We have people rebelling. So what does that do to consumption, alcohol consumption, drug consumption? People with heavy drinking or consumption patterns or use disorders, they increase their drinking to cope with stressors. This is a biological. We go into a different lecture for that. It is purely biological. We can show that in rat models. We don't need any social science there. And because of that, increased mortality. People without heavy drinking patterns decrease because, what the heck, I can't go out. I cannot really do anything. So I don't get alcohol, but I don't care because I have other problems during COVID. So we have basically a polarization of drinkings. Those who drank before a lot increase, the others decrease. But the overall level of harm increases. And that was true for drugs in most countries, and that was true for alcohol. For drugs, it has a number of other reasons as well. But look here. This is basically 100% alcohol-attributable mortality in EU. 6% increase in the whole EU, but a lot of increase in countries of the Baltic Sea, which had a lot of heavy drinking beforehand. So those are the countries who have twice as much alcohol use disorders as some other countries. So we can see that. So why do I tell you that? And why do I tell you that the national thing have to do something? Basically, we have to realize, sorry, that was the wrong one. We have to realize that countries should prepare. This has been predicted in March 2020. That was at the beginning of COVID. Most people didn't even know what COVID means. There had been articles out saying, look, this is coming now. Your drug persons, your people who drink alcohol, your cigarette people, they will increase. You should do something. You will need your hospitals for other things. They will not get in there. You have to develop phone, different things. So what did most countries do? They cared for poor alcohol industry. They actually loosened the laws. They said, oh, now you can buy via phone, or you can actually order from your computer and you will be delivered. Nobody did anything for the people. Nobody did anything in healthcare. But there was a lot of actions for alcohol industry. So basically, this is what I was trying to say. There are no golden rules. But if we want to have a solidarity, a social system, if we want to anticipate and prepare, why don't we just listen in the beginning? We know how to prepare. We know what to do. Why don't we do anything? And I'll stop here.
Okay, fantastic presentation, very inspiring. Now we can take few questions. Please raise your hand, and there are mics to take questions.
Thank you very much, Doctor, for the great presentation. I respect all what you said. Coming from a Muslim country, I've lived through 2 Muslim countries. One of them is having strict legal against alcohol, Qatar, which is banning almost alcohol except in some places. While growing up in Jordan, and the alcohol regulations is loosens with time, and the amount of people is increasing with addiction and alcohol. And thinking in the future to make a positive change for those countries. What is your advice for us as a junior psychiatrist or junior people in the field?
For Muslim countries and alcohol policy, at this point, we have no evidence. Let's put it this way. As long as the social control via religion is as strict as it currently is in Muslim countries, there is alcohol control policies are not a big theme. On the other hand, you should know that alcohol industry has put several billions in exporting 0% alcohol into Muslim countries. Why that much? First of all, because Muslim countries do not accept the alcoholic definition of Western countries. 0.5 is not a non-alcoholic drink in Muslim countries. It is in our countries, in some countries, not all. Let's forget it. And basically, why did they do that? Well, I've been present in one board meeting, and they said, we bet on that these countries change. And once they change, we have established our Heineken Zero. We've established our brand, and we've established that beer is the alcohol to go. And so then you need an alcohol policy. At this point, we have examined most of the Muslim countries. It works. The social control works. The informal control works. And there is no need for a formal alcohol control policy. It often costs more than it brings for the health of the population.
Hi. Thank you. Very, very inspiring talk. My question is, I think you're describing the challenges of prevention, which has long been very difficult in a wide range. And a big part seems to be, on the research side, collaborating with social scientists who point us to behaviors that we need to address. I wonder what you think the role is for physicians on the ground to go out and affect society in a way to maybe shape culture and illustrate points from the addiction end.
Well, it depends again on the drug. But in most countries which have physician surveys, physicians drink more than the general population. It's very hard to argue against a behavior which is shared by the majority of the physicians. So I think that is one of the problems. The second is not for physicians. Physicians live off in our remunerated system as others. That means that we have to correctly pay and reimburse physicians for their services on the prevention side. And that can go into the primary prevention and the secondary prevention, such as brief interventions which exist for drugs, which exist for alcohol, for tobacco, for all substances. So those would be but we should always keep in mind that physicians also have a history, and as long as if they drink that much, I think it will be an uphill battle.
Hello, thank you for presentation. I wanted to ask, I saw in one slide that tobacco harm is pretty high, and the ends, electronic cigarettes harm, it's pretty low. Does it mean that we are coming to the harm reduction model into tobacco sphere? We can change it into the ends or some other non-combustible products, what it means? Thank you.
Well, first of all, the tobacco end game is a game of only a few countries in the world. Most countries, not most countries have relatively stable tobacco rates, and the countries who spoke about the end game are few. But yes, there are countries where there is acceptance for changing into different alternative delivery modes, and we have to regulate those delivery modes in a way that they actually are linked to less harm. And that is the challenge, and that is something which at this point I have not seen a very convincing solution.
Yes, yeah, thank you for your talk here. This may be outside the context of your scope of what you want to talk about, but of course you're talking about alcohol and tobacco, which are legal products, but the impact of regulations and trials of trying to control illicit products becomes a different thing, because what happened with America with prohibition is then, of course, that was what gave birth to the mafia, and of course, then what happened was when you banned the legal substance, they came up with illicit substitutes, moonshine, and all the illegally produced things. And there's a lot of thought, perhaps, or there's some thought that what has precipitated the opioid crisis in America was the fact that all these restrictions came onto prescription opioids, and then heroin came in. And from heroin, once it becomes, when you try to control it with illicits, then the general push is to get more and more potent illicits. And so now even in America, for example, now you have alternatives to, this is particularly in states in America, the red states, where marijuana is still illicit. Now we have people with marketing Delta-8 and other alternatives. So I'm wondering if this may be beyond the scope of what you can get into, but the impact of regulation on illicit substances.
I mean, the basic gist is, you made a number of statements. It depends on the values of a society. Okay. During Prohibition, very clearly there were a sharp decline of liver cirrhosis. Yes, there was illegal, but the illegal did not replace the legal. And there was a sharp decline in liver cirrhosis. On the other hand, there were other consequences which were seen by society as more worth. That is what I'm trying to say. What we should do in drug policy is we should sit together in Parliament and discuss the various options. We know what happens if we make something illegal. We know the negative consequences, we know the positive consequences. We even know how to minimize them. But at this point, we need decisions and we need to openly discuss. And at this point, I don't see that. Almost no, when you discuss drug politics in North America, 90% of the time, you know exactly what the next speaker is going to say, because you've heard it so often. And that is part of the problem. There's no more talking. There's no more ringing for solution. There's no more establishing of common goals as a society. There's only known propaganda battling one another. And that is part of what we have to escape. And once we establish our values, and those values will be different in a Muslim country than in a non-Muslim country. Just to give you an example, once we have established our values and say, okay, based on those values we want to do something, then it becomes way easier. But at this point, we are looking for solutions, which means the solution which can be done in every country. And that's wrong. We cannot do that.
Can I?
Thank you very much. Just join me in. Okay. Now we go for the last part of the introduction today. Please.
Yes, dear friends, maybe you can stay some few minutes with us. We now have Professor Gerloff here. He's the CEO and Medical Director of the University Hospital Hamburg. We had a small problem with the communication with the times, so please excuse that it is now a little later, but I said now the audience is even more full. There's more people here right now, so it might be even nicer to speak here now at 10:30. Professor Gerloff, the stage is yours, please.
Yeah, thank you very much, and sorry for the inconveniences. But I'm very happy to be here and be able to welcome you and give you my warmest regards from the University Medical Center in Hamburg. I don't know if you have heard a bit about it. It's a relatively large center with about 2,000 beds, and it's in the middle of a huge network that at the end has a catchment area of more than 4 million people. And addiction medicine is very, very important. So I'd like to do two things. First, to welcome you from our perspective and also give you a chance to see that Hamburg has usually always good weather and on average less rain per year than Rome, so enjoy it. But the second thing is a bit more serious. So I'm a member of the German Science and Humanities Council, a so-called Wissenschaftsrat, which is probably the oldest gremium in Europe to advise the government, national government on issues on science and directions of science, relevant questions that we should address in science. And this council has now, for a period of approximately 2 years, a focus on prevention. And obviously, addiction medicine in the context of prevention is extremely important. And that's why I'm very, very happy that I've seen the program, that you have many aspects that relate to preventing addictive behavior, and that this is an aspect that you pick up on this conference here. And I've seen that there are participants from like about 50 different countries all over the world. I think it's extremely important, especially in these geopolitical times where everybody seems to do his or her own thing, that we sit here together and address this enormously important topic, because I think preventive measures, we are really bad at this in Germany. Prevention in Germany does not work very well. We know how much money we put into it and how many programs we have, but we also know how the average life expectancy is, and that we have a big, big issue with this. So we are pushing this and we are focusing on it. And one part of prevention is obviously addiction medicine. Prevention is much more than addiction, but also addiction medicine is obviously much more than prevention. But those interfaces between the two topics are super important and are right now in the focus of our agenda. So I'm happy to have you here as guests in Hamburg, and I wish you a great conference. Thank you very much.
Thank you very much, Professor Gerloff, and now please enjoy your break.